Can y'all hear me okay? Well, good morning, everyone. My name is McClain, and today I'll be presenting my project for the summer, which was that endoscopic myotomy is a highly effective and safe therapy for Zenker's diverticulum. Before I begin, I'd like to go ahead and thank Dr. Norman for being such a great mentor for me for this summer, as well as Mr. Sarifu and Dr. Pine for all their help analyzing the data. So to give you a little bit of background, we're talking about Zenker's diverticulum, which is essentially an outpouching of the back of the throat, right at the upper esophageal sphincter. And it is caused by a discordant cricopharyngeal muscle, which basically gets like a little too tight and forms this little pouch. It can be visualized right here. So there are a bunch of different common symptoms that we see, the most common being dysphagia, regurgitation, globus sensation, or that feeling like something's in the back of your throat, and heartburn. There have been multiple different surgical techniques to intervene. We started with the gold standard, which was just open neck surgery straight through, and we moved to rigid endoscopic procedures, and now we're kind of playing around with different flexible endoscopic procedures. The one today is Zenker's peroral endoscopic myotomy, or ZEPO. So this is an advanced endoscopic technique. It is peroral, so we take the endoscope, we go through the mouth. We get to that diverticular location where we make an endoscopic incision through a mucosal layer, where we will tunnel down into that discordant cricopharyngeal muscle. We perform our myotomy, we just break it up. And then as the endoscope is removed, we are going to leave behind some endoscopic clamps, which will hopefully relieve the diverticulum. So, ZEPO is approved and viable treatment. However, this is a very recently developed procedure. And so a lot of the data that we see on this procedure is either retrospective in nature, they have inconsistent follow-up, inconsistent scoring systems. So our objective with this project was basically just to provide more patient data in a standardized fashion while maintaining that real-world clinical element. We hypothesized that ZEPO would result in significant improvement of symptoms, low complication rates. So we did this by retrospectively reviewing a prospective quality improvement database. We took 24 patients that underwent ZEPO at this institution from August of 23 to June of 25. We assessed clinical effectiveness of ZEPO by using validated pre- and post-procedural tools that the patients completed in their clinical visits. These were the GERD HRQL, Reflux Symptom Index, Dysphagia Score, Eckert Score. This was our main one. This was going to be a 12-point scale of 4 symptoms: regurgitation, weight loss, dysphagia, and heartburn. And finally, the PROMIS Emotional Distress Score. How did they feel about their diverticulum? What was the psychological burden of the procedure? We also reviewed patient characteristics, barium esophograms, which are our primary diagnostic tool for diagnosing the Zenker's, as well as any intra- and post-operative complications. These could be excessive bleeding, pneumoperitoneum, pneumothorax, things like that. And finally, we ran paired samples t-tests to determine any correlations. So here's a big old table of results. I'd like to bring your attention here at the bottom, here in bold. We see that of our 24 patients, they had a mean BMI of about 27, mean operative time of about 30 minutes, as well as 0. There were no intra- or post-operative complications. I'd like to go ahead and say the first visit that they had after the procedure was about 6 weeks later. And then here is a table showing all the different tools that we discussed. I'd like to bring your attention towards the fact that not only are these results statistically significant, they're also clinically significant. We see almost a 4-point swing in Eckert score, almost 20 in reflux symptoms. You see the diverticulum size has got smaller after the procedure. So clearly there is some sort of benefit to this, at least in the short term. And then finally, looking at the symptom resolution for each symptom. These were our most commonly reported symptoms, the big 3 being dysphagia, cough, and regurgitation. Not only were these our most commonly reported, they were also our most improved. So in conclusion, we believe that because of the high favorable outcomes as well as low complication rates, if you're at an institution with advanced endoscopic experience, ZEPO may be a safe and effective procedure for the short-term management of Zenker's diverticulum. We have no conflict of interest to disclose. I really appreciate you guys' time and attention, and I'd be happy to take your questions. Thank you.
With the improved outcomes, and certainly it looks like you'd have much less morbidity with that, how soon do you think that this can be brought to the community hospitals?
So we are trying to implement it a little bit in the community hospitals. A lot of it is a proven treatment, but because of, like I said, that research and the literature is still not completely perfectly sound. We hope that by doing this and other people doing more different studies, we can try to get it more kind of mainstream. Also, a lot of these procedures, like I mentioned, the open neck, the rigid endoscopic, a lot of surgeons just love doing that. There's some older surgeons at Mayo Clinic that are wizards at open neck, and they love it. Dr. Norman is fantastic at the Z-bones, he loves that. So a lot of it is up to the surgeon's discretion.